acid.
Today, we are having extreme privilege to invite our panelists as well as the experts in this particular session. We are having our director, we are having members from the government, and also our collaborators who are from the UN World Food Program. So let us begin today's webinar of the live stream, and it is also being live streamed. Thank you all for joining us, especially our speakers and panelists who have taken time to share their expertise and the participants of this particular webinar series. My name is Dr. Anuradha Ramesh, and I will be the host for today's session. Today's webinar will be structured as follows: an overview presentation on the micronutrient deficiencies and malnutrition, so that we have the public health rationale and the nutritional evidence for rice fortification. The second presentation focusing on implementation, policy, and the program experiences and the initiatives by Government of India. This will be followed by the panel discussion with our speakers with a question and answer session at the end. And we are all waiting, eagerly waiting for the results of the essay and the poster competition, which we had conducted on rice fortification. I am Dr. Anuradha Ramesh, and I'm an assistant professor with the PG Department of Programs and Research in Sir Vithaldas Thackersey College of Home Science, Empowered Autonomous Status, SNDT Women's University. And I take this opportunity, and it is an honor for me to welcome you all for this particular webinar series. Rice fortification is scientifically proven food-based approach to address the micronutrient deficiencies, especially iron, folic acid, and vitamin B12. Rice is a staple food for more than half of the world's population. Fortifying rice with essential micronutrients has emerged as a key public health strategy to address these deficiencies, particularly among the vulnerable population. Fortification as a process is being done through different methods, which our experts will be discussing today, and the fortified rice kernels containing the micronutrients as per the national standards. And what is important for us to observe here is the process does not change the taste, texture, appearance, or the cooking properties, so that the cultural acceptability and there is no change in the dietary habits for the respective people consuming it. What is the Government of India initiative? To address the widespread iron deficiency, anemia, and malnutrition, fortified rice is being distributed through major food safety net programs, which is the public health distribution systems, integrated child development services, and the PM Poshan midday meal scheme. So this initiative by the government has been on a phased nationwide rollout and supported by the policy mandates and central funding, and it aims to reach over 800 million people. So what is the sustainable development goals that we are looking at? We are looking at the sustainable development goal of zero hunger, good health, and well-being for all the citizens of this particular country. We, Sir Vithaldas Thackersey College of Home Science, Empowered Autonomous Status, is a technical unit for this particular initiative, and we have collaborated with the UN World Food Program, and we take pride in helping or in organizing this webinar series for creating the awareness about rice fortification. A brief glimpse at the literature of rice fortification in India. As you can see, there is a micronutrient deficiency burden as per the NFHS 5 survey. And the study has been conducted across the different life ages. So, from pediatric to geriatric, from young children to older adults, we have seen micronutrient deficiencies as well as there is anemia that is being present. And therefore, there has been key studies that has identified the necessity for the micronutrient interventions, the educational campaigns for the fortification to confirm the nutritional adequacy for everyone in the country, and schools and colleges as effective platforms to promote this particular area. So, the rationale for this collaborative web series has been to understand or address the urgent need for awareness, technical understanding, and operational capacity building amongst the different stakeholders for implementing the rice fortification through the public distribution systems and other welfare schemes. So the webinar format has been selected because it could reach wide across for the participants in this particular for different stakeholders, and also it is an interactive learning and knowledge exchange. So the webinar series structure that has been decided is on the basis of session 1, which is today's session, which is why fortification for the rice, the need for fortification, the scientific evidence and the policy framework, which will be followed by two other webinars of session 2 and session 3, which is how to fortify rice and how to sustain and scale. So what is the objectives of this particular webinar series? To raise awareness about the importance and benefits of rice fortification, to provide technical insights into the process and quality standards of rice fortification, to discuss the operational strategies for implementing fortified rice in the public distribution supply chain, and to foster further collaboration among the stakeholders, including policymakers, rice millers, food inspectors, nutrition experts, and civil society. As we begin with the webinar series, first webinar series today, we are going to address the most important situation which has been the rationale behind this particular rice fortification, which is the micronutrient deficiencies which has been observed in the general population. So we have our first expert session, the overview of micronutrient deficiencies and malnutrition in India. For this, I would like to welcome our expert, Dr. Nisha Bellare, who is a registered dietitian and an assistant professor in the postgraduate programs and research. Dr. Nisha Bellare has her doctorate in biological sciences and master's in food nutrition and dietetics, and is a certified dietitian with the recipient of UGC Junior Research Fellowship Award. She is currently placed as assistant professor in the Department of Postgraduate Programs and Research. She is the lead coordinator for SVT online programs, and she is a Green Club faculty coordinator and Green Initiatives and SVT Eat Right Campus Initiatives. And her areas of specializations include clinical nutrition, community nutrition, and she has guided master students, and she has more than 40 publications in international and national peer-reviewed journals. With this, I will stop sharing my screen, and Dr. Nisha Bellare will be able to take this particular session forward. Dr. Nisha Bellare.
Thank you so much, Dr. Anuradha, ma'am. Just share my screen. Is my screen visible, ma'am?
Not yet. It is loading, Nisha. Dr. Nisha. Yes, it is visible. Yes.
Shall I begin?
Please.
A very good evening to one and all present here. The topic of my presentation is overview of malnutrition and micronutrient deficiencies in India. WHO defines malnutrition as an imbalance in the nutrient intakes, that is undernutrition and overnutrition. As per the data by NFHS 5 survey, it was seen that 35.5% of Indian children are stunted under 5, 19.3 children were wasted due to acute malnutrition, 32.1% children were found to be underweight due to combined acute and chronic malnutrition, and approximately 50%, 57% of Indian women were found to be anemic. The factors contributing to malnutrition include socioeconomic disparities, especially the prevalence of malnutrition is seen higher in rural areas as compared to urban areas. Besides that, maternal education, age, nutritional status, low birth weight, and religious variations are other contributing factors. Malnutrition profoundly will impact India's future, stunting physical growth, hindering cognitive development, and reducing economic productivity across generations. And these statistics reveal the urgent need for comprehensive nutritional intervention. Looking at the trends in malnutrition indicators in India, from the year 2005 to 2021, the observations are as follows. Overnutrition is rising from 12.6% to 24% in women and from 9.3% to 22.9% in men between NFHS 3 and NFHS 5. While underweight prevalence is almost halved in both the genders, declining from 35.6% to 18.7% in women and from 34.2 to 16.2 in men during the same period. Undernutrition indicators in children under age 5 show declining trends, but this decrease is very modest. Further, if we study the trends in child malnutrition from the same data, there are certain positive developments as well as some emerging concerns which we see. So the positive aspects include steady declining stunting rates, gradual reduction in underweight prevalence, improved wasting indicators in recent years, but the concerns include rising childhood overweight and obesity, persistent anemia rates remain high, and a growing urban rural nutrition divide, which is very much prevalent. If we look at these heat maps, which are representing the percentage of underweight and overweight individuals across different states in India, we see that in the first, that is the A part, if you see prevalence of underweight children under 5 years has been observed in the highest amount in the central and eastern states. For overweight children under 5, higher values are seen in northern and northeastern regions. Prevalence of underweight adults predominantly are seen in higher range in central and southern India. And again, prevalence of overweight adults, if you see, is more pronounced in urbanized areas and southern areas, demonstrating a very rising trend of overnutrition. Malnutrition dichotomy in India has been posing significant health risks. If we look at the physical effects of undernutrition in children, we see weakened immune systems, which make them more susceptible to infections, causing lifelong health challenges. Besides physical effects, we also have psychological effects in children, which include poor cognitive skills, due to which there are productivity losses. We see early morbidity and mortality, reduced educational attainment, and perpetuating cycles of poverty. On the other hand, if we see implications of overnutrition, overnutrition coupled with social stigma has given rise to a variety of mental health issues like anxiety, depression, body image disorders. A study carried out also showed that there is a higher or a greater link between non-communicable diseases and a higher than normal BMI, which could lead to higher rates of mortality. And if no stringent action is taken at this point of time, the economic burden of overnutrition will increase by 19 folds by 2060. Now, there's another very important aspect which we need to look at is the double and triple burden of malnutrition. So, in a study carried out wherein NFHS has also reported that India faces an unprecedented nutritional paradox where undernutrition, overnutrition, and micronutrient deficiencies coexist within the same households and community, and approximately 7.7% households were found with undernourished children and overweight or obese mothers, with contributing to the double burden. Similarly, triple burden, we saw 5.1% of the households facing undernutrition, overnutrition, and micronutrient deficiencies simultaneously. If you look at the root causes for double burden and triple burden, it includes poor diet quality with inadequate diversity, economic inequality limiting food access, limited availability of diverse nutritious foods, nutrition transition towards processed foods, inadequate maternal and childcare practices, and various gender disparities in the food distribution at the household level as well. Moving on to micronutrient deficiencies is also known as hidden hunger because the subnormal levels of certain vitamins and minerals can increase general morbidity and mortality without any obvious clinical signs or symptoms to suggest deficiency. Now, if you have mild to moderate minds can affect a person's well-being and mental functioning, and health impacts are not always acutely visible and hence the name hidden. It is not necessarily reported only in a disease state, but is prevalent and is bound to have a negative impact on any apparently healthy individual as well. It is clinically challenging to identify or screen these deficiencies, and individuals with micronutrient deficiencies are at a higher risk of diabetes, hypertension, osteoporosis, asthma, depression, and a host of other disorders. Understanding micronutrient deficiencies, the three major prevalent micronutrient deficiencies which India is combating is iron deficiency anemia, vitamin A deficiency, and iodine deficiency. And in addition to that, there are various other deficiencies as well. Micronutrient deficiencies, based on a 2016 data, contributed to 0.5% of total deaths in India, which can be a completely preventable tragedy if immediate action is taken. Usually, the causes of micronutrient deficiencies are related to daily dietary inadequacy because of reduced bioavailability in plant sources. Vegetarian diets provide an inadequate nutritional intake of omega 3 fatty acids, B12, and minerals. Insufficient intake owing to the weight reducing and imbalanced diet which people keep following, and wrong dietary and modern eating habits. Increased consumption of junk food leading to unhealthy snacking habits, eating disorders, emotional or physiological stress. If we look at micronutrient loss in food, it is contributed to the farming techniques and food processing, which results in plant micronutrient loss. And because of the various different cooking techniques which are used, it leads to a loss of vitamins that is approximately 25 to 40%. When we look at the consequences of micronutrient deficiencies across lifespan, so infants with micronutrient deficiencies usually report low birth weight, higher mortality rate, and impaired mental development. In children, it would manifest as stunting, reduced mental capacity, frequent infections, reduced learning capacity, higher mortality rate. In adolescents, again, stunting, reduced mental capacity, fatigue, and increased susceptibility to infections. In adults, the productivity decreases in addition to malnutrition and increased risk of chronic diseases. In pregnant women, the mortality rate is higher and increased perinatal complications. And in elderly, it would lead to increased morbidity with respect to osteoporosis and mental impairment, as well as a higher mortality rate. We look at the most common micronutrient deficiency, which is iron deficiency in India. Approximately 57% of women in the age group of 15 to 49 years, children under 5, that is approximately 67%, and adolescent girls and pregnant women are iron deficient in India. The dietary challenges include low bioavailable iron and, of course, the presence of phytates and tannins in food, low vitamin C intake. The recommendations or solutions to this is dietary diversification, fortification, supplements, and increased nutritional awareness. If we're looking at prevalence of anemia based on regional areas, we see that significant geographical variation in anemia is prevalent among women and children across Indian states, with eastern states bearing the highest burden, especially when it comes to children 6 to 59 months of age. You see highest in Bihar, Jharkhand, Odisha, and West Bengal. So these are the states which are very much affected. If we are looking at the prevalence of anemia and iron deficiency among children and adolescents, the highest is in the age group of 1 to 4 years of age, that is around 20.8% of the children are affected, followed by 12% in the 10 to 19 age group. We also, this is a very interesting finding which came out from Comprehensive National Nutrition Survey, which studied the prevalence of micronutrient deficiencies in children under 5 who were anemic versus non-anemic. So it was observed that approximately 72.6 children who were anemic under 5 also had folate and vitamin B12 deficiencies. In terms of males and females, females were found to have higher micronutrient deficiencies and were anemic, that is approximately 76.4 and 71.4% in male children. Based on CNNS data, it has been observed that vitamin A deficiency is a severe public health problem in many states. If you look at, so if more than 20% of the population is vitamin A deficient, it serves as severe public health problem. So in states of Madhya Pradesh, Jharkhand, Bihar, Chhattisgarh, Assam, children aged 1 to 4 years are vitamin A deficient in a greater amount, whereas adolescents aged 10 to 19 years, areas like Chhattisgarh, Jharkhand, and Bihar are very highly affected. When we look at vitamin A deficiency, national data from surveys suggest that 20 to 30% of children under 5 suffer from clinical or subclinical vitamin A deficiency. India implements universal vitamin A supplementation for children aged 6 to 59 months under the Poshan Abhiyan food fortification. The target usually which vulnerable group is more affected by vitamin A deficiency, children under 5 and pregnant. It also increases the risk of measles and diarrhea, and rural areas and low income population is more affected. Low diet diversity scores are one of the very important reasons, because India is a cereal dominated country, so poverty, food insecurity, and limited nutrition knowledge. And vitamin A deficiency usually would manifest in individuals as xerophthalmia, increased infections, and night blindness. If you're looking at prevalence of vitamin B12 deficiency, it's highest in the 10 to 19-year-old age group. And usually B12 deficiencies are caused by low intake of vitamin B12 or abnormal absorption. So approximately 31% of the population in the age group of 10 to 19 years is deficient of vitamin B12. Higher vitamin deficiency is usually seen among children and adolescents. So children aged 5 to 9 years and adolescent aged 10 to 19 years had similar levels of vitamin D deficiency, higher than children aged 1 to 4 years. Seasonality also affects vitamin D deficiency, and usually analysis, if you see the trend, there's lower prevalence in May to September and higher prevalence during winter. The factors in Indian context include cultural clothing styles, urban and indoor lifestyles, which reduce sunlight exposure, darker skin tones, low dietary intake further exacerbates the problem. Usually, the consequences would be seen as rickets and skeletal deformities in adults, bone pain in children, bone pain and increased fracture risk in adults, and 50 to 90% of Indians have insufficient or deficient levels. Pregnant women and newborn are also affected by vitamin D deficiency. Approximately 40 to 50% of Indian children under 5 may suffer from zinc deficiency. It can also affect pregnant women and low income populations. It's very, very essential. Zinc is very essential mineral during infancy, childhood, and pregnancy. The causes also may include poverty, low diet diversity, and food insecurity. And in pregnant women, zinc deficiency could lead to outcomes like preterm birth, low birth weight, and restricted fetal growth, and in adults as recurrent infections and malnutrition. If we look at iodine deficiency in India, it will usually manifest in adults as goiter, hypothyroidism, then impaired cognitive development and cretinism. Rural and economically disadvantaged populations are at a higher risk, and the outcomes could be risk of miscarriage, stillbirth, and congenital abnormalities, lower IQ, poor academic performance, and attention deficits. The government has has already implemented universal salt iodization program very well, wherein salt is mandatorily iodized with iodine, and in many states it has worked to a very good extent. If you're looking at potential solutions and recommendations for micronutrient deficiencies and malnutrition, we need to focus on capacity building, accountability, and community engagement. We need to train community health workers for monitoring and promoting nutritional programs at the grassroots level, and engaging local leaders and volunteers to enhance the reach and impact of nutritional programs. Role of food fortification is of utmost importance. The UN goal aims to eradicate hunger and ensure food security and nutrition by 2030. The Eat Lancet Commission recommended diet for rural population under the cost of Indian cost of $3 to $5 per person per day, while the current cost is just one. So, sustainable food is not accessible to a huge population, and hence food fortification, which involves the process of adding essential vitamins and minerals to staple food, will have a greater reach and would help in better combating the problem of micronutrient deficiencies. Also, the role of diet diversity cannot be ignored. Only 11.3% of children aged 6 to 23 months receive minimum acceptable diet. And low diet diversity is directly linked to higher risk of stunting, wasting, and multiple micronutrient deficiencies. And we all know that the first 1,000 days from conception to age 2 is very critical, and hence adequate diet diversity during this window can prevent irreversible damage. Usually, the factors for low diet diversity scores include urbanization, where we shifted from traditional diets which were more diverse, lifestyle changes, individual diet diversity score, household food distribution disparities is also one of the reasons for low diet diversity. Role of food hygiene. So 50% of malnutrition is associated with inadequate water, sanitation facilities, and unhygienic practices. And data has also showed that diarrhea has been one of the leading problems from 2010 to 2019. And hence, raising awareness about food spoilage and illness is of utmost importance. And training with respect to food safety measures also needs to be provided. There are certain government initiatives which tackle malnutrition and micronutrient deficiency. So one is ICDS program, which provides supplementary nutrition, health services, and early childhood education. Besides this, Mission Poshan 2, which is a comprehensive nutrition mission focused on holistic development and addressing malnutrition across the life cycle. Weekly iron and folic acid supplementation program targeting women and adolescents to combat anemia. School meal scheme improving nutrition and educational outcomes for millions of children is done via midday meals. Role of stakeholders in supporting this entire endeavor is of utmost importance, and hence there are certain NGOs which conduct essential awareness campaigns aimed at educating parents about nutrition, hygiene, and health practices. Community-based monitoring and feedback mechanisms is also very important. International organizations like UNICEF and World Food Program have been providing essential technical expertise, financial assistance, and opportunities for capacity building. Of course, we know the challenge we've discussed, malnutrition and micronutrient deficiencies. So the solution includes data-driven policies, robust monitoring system, meaningful community engagement, which could serve as foundations for achieving sustainable nutritional progress across all states. And by strengthening nutrition programs, of course, we would be improving dietary diversity and closing regional gaps. We can secure a healthier and more productive future for every Indian child. So thank you so much for your patient listening.
Thank you, Dr. Nisha Bellare, for this very insightful presentation. And you have touched based on all the statistics and the need for fortification to combat this problem of micronutrient.
Thank you so much.
Deficiencies. So we move on to the next expert session, and that is going to be by Ms. Nandita Joshi, and she is going to give her presentation on the policy initiatives by the Government of India. Just a very brief introduction about Ms. Nandita Joshi. She is a senior program associate with the UN World Food Program, and she's acting as an technical support partner to the government of Maharashtra for the implementation of fortified rice under public distribution system and other government welfare schemes since April 2024. And this role of hers is seen her working with a lot of state government stakeholders on strategy, policy, and large scale implementation. So, prior experiences, she has worked in the take home ration for the novel nutrition supplementation initiatives, again by the government of India. She is also having the experience in nutrition management of non communicable diseases and evidence based interventions through government and multi stakeholder collaborations. She is also a nutritionist by her education, and she brings this aspect also into the current role of this particular area. So I will now stop sharing my screen, Ms. Nandita. We welcome you to enlighten us on the policy initiatives by the government of India. Please share your screen.
So thank you, Dr. Anuradha, and thank you, Nisha, for putting up the complexity of the issue and the gravity of the nutritional aspect so well. It will help me put forward the rice fortification bit in context. So I'll just put across my slides. Please let me know when they're visible.
Yes, it is visible.
Okay, okay. So
you can put it in the start. Yes, thank you. Thank you.
Yes, yes. So I'll be after detailed presentation by Nisha on why it is important and the nutritional issues, the gravity, complexity of the issues. I will just take you quickly through the policy initiatives that the government of India has taken, and especially the bit on rice fortification. So, okay. So the why we are doing, and I will just add on to a few points what already Nisha has addressed. This is to basically do micronutrient deficiencies, and which is we are focusing right now on three major, although there are a lot of other nutrients, micronutrients which are deficient, but three major ones that are focused by the government right now are iron, folic acid, and vitamin B12. As we know, majority of the population which is vegetarian tends to have a B12 deficiency, and iron folic acid is something which has been deficient, and it has been documented in research so far. So, and this has been leading to anemia in the population, which Nisha addressed the gravity, and it is basically largely for women and children. And so improving overall their health outcomes will affect the GDP of the country at large. And all of this is in alignment with the health goals, the SDGs, so that we have zero hunger, SDG 2, SDG 3 for good health. So the Poshan Abhiyan and all of that is aligned to this. And like unlike many other countries, India is one country wherein a lot of food distribution is done. And so this rice fortification has been piggybacked on the overall food distribution scheme by the government, which is the public distribution system for vulnerable population. Then we have ICDS, which is for nutritionally vulnerable populations. So it is given to all government welfare schemes wherever rice is given. So overall, we've seen that why we're doing it at national level, and there are some global backing to it, because one, it is now to ensure. So we've been working on, we've seen a lot of research done on fortified rice in many countries, but the idea to be able to implement it in a country as large as India was only possible after the government came in. So it integrated with the national policy, the NFSA guidelines, and overall the Poshan Abhiyan. So it is now mandated that all rice which is supplied across the country in any government welfare scheme will only be fortified rice. And this was done in a phase-wise manner, and all the ICDS, the midday meal, and the PDS, which all these three are the largest suppliers of staples in welfare schemes, were given a stage-wise, step-wise manner, and March 2024 was a target until which it was addressed that all the rice across all social safety nets should be 100% saturated with only fortified rice. And this scheme has been centrally sponsored till now, and it is now sponsored till 2028 by the Government of India for all the states. Now, all the standards and safety, it's a scheme in which a lot of stakeholders have come together. So all the standards and safety have been defined by FSSAI for the fortified rice. All the SOPs have been given, which are guaranteeing the safety, the effectiveness, and it is a very versatile, it's a very evolving process. So every year when implementation is done, challenges are seen. So norms are changed, and that is how this fortified rice is being implemented in the country. Now, this is all of this, although it is aligned with also the national policy and policy for the country, it is also aligned with global policy at large. So it is aligned with the SDG goal 2, which is zero hunger, and SDG goal 3, which is overall to reduce hunger and improve health. So all of this is aligned not only to the national framework, but also to the global framework. So if you look at the coverage which is done under PDS, MDM, and ICDS in India, just to let you know the amount of beneficiaries, the amount of rice that is given. So in PDS, overall in India, around 81 crore beneficiaries are supported, where all the Antyodaya and Yojana scheme, in which below poverty line beneficiary card holders are given 35 kg of rice per family, which is a combination of rice and wheat or other grains. And then there is a priority household scheme in which 5 kg per person per month, which is also a combination of either completely rice in some states, and there are some states where there is a combination of rice with some other grain. So around 81 crore beneficiaries are supported. In midday meal, around 11.8 crore school children are supported. They are given cooked school meals every day, either through central kitchens or they are given cooked at their school level. And in ICDS, overall, it's around 8 crore children and 1.8 crore women, which are given supplementary nutrition based take-home ration either, or there is hot cooked meal given in the Anganwadi itself. So all the rice that is used either in supplementary nutrition product, which is the take-home ration packets, or hot cooked meal is only and only fortified rice. When I look at these numbers at state level implementation, the NFSA beneficiaries of PDS in Maharashtra is around 7 crores. And monthly rice allocation to them is around 3.5 lakh metric ton, which is approximation annually is 28 lakh metric ton when we give overall. The midday meal coverage, if I see in Maharashtra itself, we have around 90 to 95 lakh children which are given midday meal every month and in the school, and in which fortified rice is given. So all the children which are under 5 are given 100 grams of rice per day. All the children above grade 5 to grade 8 are given 150 grams. Then there are a lot of extrusion plants, which I mean fortified rice kernel manufacturing is done also within the state. We have 8 FSSAI notified FRK manufacturing plants which produce fortified rice kernels, which are mixed with rice to ultimately in the ratio 1:100 to make fortified rice. So this is the state level implementation. So all of this was not done suddenly, because if you look at 7 crore beneficiaries, we cannot, with only 8 plants, it is not possible to do that instantly. So there was a lot of time which was given for the states to gradually pick up. It was done in phased wise manner. So in the first phase, there were certain districts which were picked up, which were districts which were either high burden with micronutrient deficiencies, or there are certain aspirational districts. So there are 14 out of the 36 districts of Maharashtra, there are 14 which are aspirational and high burden. So they were given first priority because these are districts which have maximum burden of micronutrient deficiencies. And in the second phase, it was rolled out to all the districts. Then there are a lot of key stakeholders. So this is something which involves a lot of different stakeholders coming in. So multiple stakeholders means different ministries coming together. There are if I speak of PDS, the Department of Food Civil Supplies involved. There is FCI which is involved because they provide deficit rice, which department is not producing. Then there is a local FDA and FSSAI, which makes sure that the grains that are the provided, there are certain SOPs which are followed. So all of those are there. Then regulatory bodies ke baad you have millers which are involved, and development partners we come in just to give technical support to the government so that they are aligned with not just the government of India standards but also global standards. So there is a lot of key stakeholders revolving around this, and all of them come together to deliver this kind of scheme in the state. A lot of monitoring and quality assurance is done because, again, as I said, it is a evolving process. So it was initially started that only blenders need to be put up. Then it was realized that to ensure that every gunny bag has 1% of blending properly, the government quickly came in and improvised. So there was something called as dynamic blenders, or blenders which were able to ensure load cell based blending, which means 1 gram per 100 gram is ensured in every 50 kg of gunny bag. All of these setup machineries are done by BIS standards. Then how do we check the quality of the product, as in the fortified rice which the millers are making before taking it at our godowns to be supplied. So the quality managers do a lot of blending tests to see if the rice is properly blended. They take out 100 grams and they segregate all the kernels and all the fortified rice like separately, and then we are able to understand if it is blended properly. There's a lot of storage and handling monitoring which is done to ensure that from end to end, from the time the kernels are produced to the time fortified rice is given at fair price shop to a beneficiary, the quality is maintained and there is no depreciation of quality at any level. So you can see there are a lot of key stakeholders moving around, and then there is a lot of process involved, and every process also involves a lot of quality assurance in every step. So FSSAI comes in very strongly in this, and they have given certain standards, and all the quality standards are to be maintained as per FSSAI norms. They have mandated that the iron content needs to be between 28 to 42.5 mg per kg in fortified rice, plus folic acid and B12 also norms are given. So all the batches of rice which are taken in, all the kernels that are mixed, every batch is tested in the lab, and if the iron levels do not fall within the range that has been given, that fortified rice kernel is rejected. It is not taken in and supplied. So the quality standards are maintained. Then other than that, there is a lot of other kind of quality assurance that have been put, something called surveillance sampling, which means that when the kernels are produced, there is a third party, which is not from the state, which come in and collect the fortified rice kernels and take it to another blinded agency, and they test it and they tell us whether we must take that kernel quality or not. So it is to ensure that there is no biasness. It is to make sure that there is nobody who's influencing the process in the government setup. So all of these things have been put up. Now there are other things that are also done, like as I said, the blending efficiency test. Then there are floating tests in which we put the rice in water and see if there is any kernels which are coming to the surface. So if they are coming to the surface, which means they are floating, it means their density is lighter overall than regular rice, and people will probably discard it considering that it is not of appropriate quality. So all of this is done. Then lab reports also are checked from point of view of the FSSAI notified labs only. It's not that any lab can give the report. FSSAI has given a list of labs from which all the batches of the rice kernels are to be tested and reported. So there's very strict and stringent methods which are put in place to ensure the quality of these fortified rice which is to be delivered. All of this has involved a lot of capacity building and a lot of other things. So first of all, the government financial support. The entire process, whenever it is additional, it involves some cost. So there was some extra cost which has been borne by the government. Currently, it is all of the extra cost has been borne by Government of India for all the states. So they have allocated now 17,000 crores until December 2028 only for fortified rice distribution, additional cost for fortified rice distribution. Then there's a lot of infrastructure development that has taken place. So the government has ensured that all the rice millers that they take on board are using proper machinery, which is as per BIS standards. All the storage is as per FSSAI standards. So alignment to that. Then a lot of capacity building was done, not for all the stakeholders, which includes rice millers, fortified rice kernel manufacturers, then quality assurance people from the state, food fortification technology control, quality control. So all of this was done. In rigorous last 2 years, a lot of trainings of these officials have been done. And lastly, and most important, that which has been done is the awareness. So the government of India, because it is centrally sponsored, had allocated funds for IEC implementation for all the states. So all the states have been given some fund to create awareness by the government of India, and also they're additionally using the state funds to create awareness, because it has been identified that no matter how much quality of fortified rice or rice kernels we create and produce, if the end user, the end beneficiaries, the 7 crore beneficiaries which are there, if they are not consuming it, there'll be no impact. So a lot of awareness related support is also being done. So overall, what are the future plans and what are the barriers? The first challenge that has been, because it's an evolving process, so every year some issues are seen and some corrective action for that is created. So supply chain and readiness, the consumer awareness, overall the quality consistency across are some barriers which has created fortified rice as an issue. And then overall for people to be aware at the pace at which the project has been delivered, and the awareness among the beneficiaries has not matched in the real term. So people are still not aware that the government is providing fortified rice free of cost, and the rice that they are getting is fortified rice. Then there's a lot of misconceptions like a plastic rice or some other aspects of rice which have been given. So target IEC campaigns are being done, which are very essential to improve overall consumer understanding. Then, as I told you, that there are fortified rice is only one aspect of the basket of grains which are provided. So wheat flour fortification or other fortification of other products which are also given in the PDS scheme is a future expansion plans. Then all of this, as I said, is requiring a lot of collaborative efforts. So all the states are working on collaborative efforts with government and private sector, government and academia, private sector and academia. All of them are coming together, because if we have to make massive changes in the community at large, community engagement and community mobilization requires to be done. So it is very crucial for sustained fortified rice program success. So all of this are the barriers, and how do we plan to correct them in the future? So overall, if I conclude, I would say rice fortification initiative is a very major policy. It will overall reduce the micronutrient deficiency and hidden hunger in India in a very cost-effective technique. As Nisha in her previous presentation also touched base on the universal iodization of salt, which was a very good campaign on how the country got hold of its iodine deficiency in the population. The same way, rice fortification initiative is a quick way to come across to and reach majority of population. Then we also understood about how government support what are the standards. So we understood that the government has a very strong governmental backing. There are very clear SOPs and quality standards. It is not just a process which is being delivered like that. It is following, it is backed by strong evidence and strong SOPs, and effective implementation is being done. Then to ensure that integration into social safety nets is there, it is not just in one. So PDS scheme, it is given across all the welfare schemes to cause a triple safety net to reach maximum vulnerable populations at a very large scale. So all the people who are in beneficiaries of midday meal will also get, all the beneficiaries who are of PDS will also get, all the beneficiaries who are of ICDS will also be supported with fortified rice product. And for a so government of Maharashtra itself and other states also are doing a very successful large scale implementation, in which all the 36 district, 52,000 fair price shops, 7 crore beneficiaries, 1.2 crore households, all of this has been done, and feasibility impact of statewide fortification efforts have been done. And like it is a evolving process, so the quality improvement is going to be evolving at a level as issues will come, it will keep on being corrected. So that is overall about the policy initiatives at large. And if Dr. Radha, from my end, this is about it. If we want to open it for questions right now or later on, is
no, we are opening for questions after the panel discussion, Ms. Nandita. So thank you for sharing those practical perspectives and the policy initiatives and real world experiences. We now move on to the panel discussion. So Ms. Nandita, if you can, we will just.
Yes.
Yeah. So we are going to the panel discussion. The topic for the panel discussion is Science of Rice Fortification, what and how, evidence on fortified rice, integration of fortified rice in rice supply chain, and policy initiatives. I request all the panel members. We have our first panel member, Dr. Jagmeet Madan ma'am. We have Dr. Siddharth Vagulkar, and we have from the government of Maharashtra, who would be joining us on this particular panel to switch on their cameras, and we would go about in terms of welcoming everyone. The moderator for this particular panel discussion is Ms. Nandita Joshi, whose talk we just heard. So let me just take a brief introduction about our first panelist, Dr. Jagmeet Madan ma'am. She is the National President of Indian Dietetic Association, former Principal Director, SVT Research Consultancy and Collaboration Center, Director of PG Programs and Research and SVT PhD Center of our college, an eminent nutritionist, a gold medalist and recipient of Young Scientist Award, recipient of prestigious various international research grants and research projects, has been awarded the Maharishi Karve Utkashta Sikshak Award, lead principal investigator of a lot of international projects, mission leader of joint review missions. Right now, ma'am is heading the National Allied Health Council for the nutritionist and the allied health professionals. She's also been on the FSSAI scientific panel, National Task Force of Nutrition and Health Benefits on Millets. She is a certified master trainer of Project Hope and National Expert Working Committee on Asian and Indian Consensus Statements. She is a PhD guide, has guided a lot of students as well as a guide for master students, and has published a lot of work in very prestigious international and national peer-reviewed journals and books. Welcome, ma'am, and for agreeing to be a part of this particular panel discussion. We have Dr. Siddharth Vagulkar. Dr. Siddharth Vagulkar is the Deputy Head, Nutrition and School Feeding Unit, UN World Food Program, India Country Office. And he has about more than 13 plus years of experience in the field of public health and nutrition. He has worked across the national and state level with governments. And we have him who is very passionate about addressing the challenges of malnutrition amongst the most vulnerable population. His areas of interest are anemia, food fortification, which is the topic for today's series of webinars. And he also holds a master's degree in public health, and he has done economics and finance from Tata Institute of Social Sciences, and has been named as the trained on management of nutrition in emergencies. Mr. Pramod Patil is not able to join us, but Mr. Shishant Patil, Section Officer, Food Supplies, Civil Supplies and Consumer Protection Department from Government of Maharashtra, has joined us for this particular panel discussion. Sir has 16 years of experience with Government of Maharashtra. He's serving as a nodal officer for fortified rice distribution in PDS, quality of fortified rice and convergence with Government of India. He has also previously worked with tribal development departments in Maharashtra. We request our moderator, Ms. Nandita, to take over the panel discussion. And we request all the audiences to post questions in the chat box for all the previous sessions, as well as questions for the panelists also. Thank you.
Okay, thank you, Dr. Radha. For the panel discussion, and thank you so much for all the panelists to join in. It is such a pleasure to, on a Monday evening, have all of you come in because we have a lot of students on our who have joined us. I would like to take this panel discussion in a bilingual kind of mode, like a Hindi and English both. I hope that works, is comfortable with all of you. And we'll have mostly so as we heard all of this conversation, the session with Nisha, and we had something about fortification of rice and all the policy and making it such a grave and big issue. I want to first ask all of you and to understand that although malnutrition has been something that we've been talking about for like so long, and I remember starting my nutrition education way back in 2005 when we also learned about malnutrition. So we've been reading and learning about so much about malnutrition for so long, but why has suddenly rice fortification emerged as such a key strategy in India for malnutrition management, and why is it that it's become so relevant right now? Matlab, itna important tha, to why didn't we start it off earlier, and why it has suddenly become important? So I would ask this to all of the panelists. This is from my own query from my own aspect. So Dr. Siddharth and Madam, and any from the government aspect, I would want to hear from everybody, from coming from somebody who is a nutritionist themselves.
Okay, I think Nandita, let me take the lead. Yeah. So first of all, at the outset, I'm extremely happy to be a part of this conversation. And why I'm so happy is that, this conversation is happening with the young adults of this country. And not only our students, but I know that there are students from various colleges who have joined here. And I congratulate all of them to have participated in the competitions which we organized, the poster competition and the essay competition, and the numbers were so encouraging. So the proactiveness of young adults is very, very important. And unless and until we sensitize this segment of our population, which is a major chunk of our population,
Absolutely,
I think, we cannot trickle things down. So Nandita, coming back to your question, uh, I know I have been associated with this kind of mass implementation right from my PhD days, because I worked on iodine deficiency disorders, and you'll be happy to know that I used the iodized salt, as an intervention in pregnant women. And, my study revealed that the supplementation with iodized salt made a difference at the cord blood level of the women. So what I'm trying to say is that at that time, from that time, reaching out to masses is a huge commitment, and you need a vehicle which cuts across socioeconomic barriers. Like it's something which is used by the poorest of the poor and the richest of the rich. And you have to bring it down to a level that even if I consume it through a minimum quantity, which is needed in my diet, it will take care of the nutrient intake. Now, when we talk of rice fortification, we are looking at micronutrients. So all the time, we all are, nutritionists and budding nutritionists. We all know that micronutrients are needed in smaller quantities, but even though they're needed in smaller quantities, but they're very, very important for such significant roles which they play in the body. So if we can make a difference in terms of the reach of this micronutrient in the diets across the population, across socioeconomic strata, I think that's one thing where rice probably fits the bill. Because if you look at India as a nation, I think maybe Siddharth would add on to whatever I'm saying. What percentage of population is rice eating? But so reach is one aspect. And the second point which I want to say is that we've been battling with anemia for decades now. So today we are even questioning that is it only the iron which we need, or we need a more holistic kind of approach. So that's where we are getting the iron, folic acid, B12 put together, because anemia is not only because of iron deficiency. We know that there are causes. And also, to my mind, again, I'm looking at it, Siddharth, you can give your perspective, but I'm looking at it from a nutritionist perspective. That first thing which is very heartening is that it's an immense platform. I mean, you look, Nandita, the figures which you gave us, the investment which the government of India is doing, which the government is doing, I mean, at state levels. You look at the figures for state of Maharashtra, which is a big state. I mean, it's if such an ecosystem is available, then besides through this ecosystem, we should not only achieve the reach of micronutrients, but we should achieve the other intents. Like, I mean, for me as a nutritionist, when I look at rice, I'm also looking at complementing rice with a protein source, so that in totality the protein intake also goes up. I'm looking at using local seasonal vegetables in the areas, so that the diet diversity also comes in. So when I'm educating somebody, I'm starting with a vehicle which is helping me reach every house to give that bare minimum of micronutrient which is needed. But at the same time, I'm also emphasizing that if the vehicle is containing the micronutrient, I'm still wanting the protein source to be there, the fiber to be there, and the diet diversity to be there. So I think it's a brilliant initiative, and like you said, it started in phased manner.
Yeah.
It started with vulnerable groups, and it has come to the PDS now, and now we are covering the entire country. So whatever rice is available is fortified. And I think our institution, first of all, is very privileged that we are partnering with World Food Program as a technical support unit, and we are leveraging our expertise in whatever opportunities we get to sensitize the stakeholders in different ways. And recently we have also done some work in Gadchiroli district, wherein we have looked at the role of rice fortification in the take home rations. So you spoke about the midday meal program, and you also, which was very heartening to hear, that integration of all the programs coming together with rice fortification. So I think these are very, very important initiatives. We become stronger, though we've been talking for last 3 decades, Nandita, but I think in the last 4 decades of my existence in this field, I have seen that every decade we become stronger. But yes, and the biggest strength which we have got today is the digitization, which has helped streamline a lot of things in terms of delivery, in terms of quality control, all those things. So thank you. I think, Siddharth,
Yes.
over to you.
That's wonderfully put together from an additional point of view, Dr. Madan, and also the convergence of governments. So yes. So Dr. Siddharth, from a policy point of view, why do you think that suddenly rice fortification has become a major key aspect for the government?
Sure. Thanks, Nandita. And I would like to thank the SVT team for inviting me as being a part of this as a panelist here on this webinar today. And I really appreciate the excitement among the young students who've come in large numbers. And, we've had a very good attendance today for the first webinar. So, really looking forward and excited to interact with all of you. So coming back to your question, when we talk about rice fortification, it's not something which it's not something which is it's come out of the blue, or it's not something that it suddenly appeared in the public health space or so. The work on rice fortification has been ongoing since about 2 decades now. And in fact, India, along with other countries, the journey on rice fortification actually started as a pilot basis. And to tell you about some of the aspects of this journey, in fact, the World Food Program, we piloted iron fortified rice consumption through the midday meal scheme in Gajapati district of Odisha way back in 2012. And there was a pilot project which ran for about 3 years. The pilot project showed substantial amount of evidence there that if consumption of fortified rice was done, it could lead to improvement in the overall, say, prevalence of anemia. So based on that, the national government definitely took stock of the findings there in Gajapati. And likewise, we've been doing multiple pilots across different geographies in India. This led to building the momentum around fortified rice. I'm sorry, my kid is in the background. I'm really sorry about that. Yeah, but so this led to the building the momentum around fortified rice. And the national government finally took stock of the evidence which is emerging out of the different pilots around the fortified rice being implemented. And in 2021, we had the Prime Minister of India also announcing that fortified rice will be scaled up gradually through all the food safety net schemes. So it's not as if fortified rice has come up suddenly, but there's been a very gradual momentum towards, and not just World Food Program, many other developmental agencies also working on, say, fortified rice and piloting across different food safety net schemes. Coming back to what made fortified rice a successful intervention, or say, I would say not successful, but say something which could be successfully implemented in the public policy space, was that we had the challenge of micronutrient deficiencies, and we've been trying out multiple interventions. Supplementation, as we talked about, has been tried out. We've been looking at dietary diversification. But then again, despite all of these interventions, despite other public health interventions, we've still not been able to get down the prevalence of micronutrient deficiencies. And what facilitated the growth, or say, overall the launch of fortified rice, was that, as Dr. Madan mentioned, the preference to consumption of rice is there. Rice is a staple food for most of Indians. Around 65% of Indians consume rice as their primary food. Secondly, India is host to a biggest, one of the largest food safety net schemes across the world. We feed around 800 million people through the food safety net schemes that we have. That is the PDS, the ICDS, and the midday meal scheme. And rice is the primary staple cereal, which is again distributed through all of these food safety net schemes. The third thing is that, if you look at the infrastructure required for fortified rice fortification, we have about, overall in India, we have more than 26,000 rice millers across India. So that provides like a very favorable ground for, say, implementing a scheme, or say, say implementing an intervention like fortified rice. So looking at all of these possible, all of these opportunities that were presented in the context, that is what favored the introduction of fortified rice. And when I talk about fortified rice, we're not just talking about, going alone, stand alone with just fortified rice. It's going in complementary with other strategies as well.
Strategies. Oh, that's very relevant. From a government aspect, Mr. Sushant, are you here? Sushant?
जी नंदिता, मैं यहाँ पे
Hi.
हूँ।
So Sushant, मैं I wanted to understand आपसे कि आपके point of view से from a government aspect, like why do you think that overall this fortification of rice जो है आपका, it will be something which you see as impactful or something which can add a lot of impact considering कि आपकी population is as large as 7 crore beneficiaries जिनको आप provide करते हैं rice. From a government aspect point of view, how do you think about this rice fortification bill?
हाय नंदिता, मैं सबसे पहले क्लियर करना चाहता हूँ कि हमारे साथ आपने जैसे बताया शुरुआत में कि प्रमोद पाटिल साहब शायद अवेलेबल नहीं रहेंगे, लेकिन पाटिल सर हमारे साथ अवेलेबल है, डिप्यूटी सेक्रेटरी प्रमोद पाटिल सर, तो वो भी है हमारे साथ यहाँ पे।
That's
तो
wonderful.
आज हाँ, जैसा कि आपने अभी एक क्वेश्चन पूछा कि ये सब मतलब गवर्नमेंट का इसमें क्या व्यू है और कैसे आप वे कर रहे हैं, आपका इसमें क्या मायने रखता है आपका फोर्टिफाइड राइस का। तो सबसे पहले आप ये बात समझना चाहिए कि हमें महाराष्ट्र गवर्नमेंट जो है वो महाराष्ट्र सबसे बड़े राज्यों में से एक राज्य है हमारे यहाँ पे, स्टेट गवर्नमेंट ऑफ महाराष्ट्र इंडिया में, जहाँ का टोटल पॉपुलेशन करीब 12 करोड़ है पॉपुलेशन का, और उसमें से 7 करोड़ पॉपुलेशन को हम राइस डिस्ट्रीब्यूट कर रहे हैं। और इतने बड़े पैमाने पे हम राइस डिस्ट्रीब्यूट कर रहे हैं, तो हम पिछले 5-6 सालों से इसमें हम ये काम कर रहे हैं। पहले तो हमने ये पायलट प्रोजेक्ट के जरिए काम किया 2019-20 में, हमने 1-2 डिस्ट्रिक्ट में, जैसे कि जो एस्पिरेशनल डिस्ट्रिक्ट्स है गढ़चिरौली, वहाँ पे हमने डिस्ट्रीब्यूट कराया। फिर उसके बाद हमने 22-23 से लेके फेज 2 में कराया कि हमारे 17 डिस्ट्रिक्ट में हमने फोर्टिफाइड राइस डिस्ट्रीब्यूट कराया। और उसके बाद 2024 से लेके हमने पूरे महाराष्ट्र में फोर्टिफाइड राइस डिस्ट्रीब्यूट करने के लिए ये योजना हमने चालू कर दी। तो एक्चुअल जो इसका एम है, महाराष्ट्र गवर्नमेंट ये चाहता है कि हमारे जो बेनिफिशरीज है, तो उन बेनिफिशरीज को हम फोर्टिफाइड राइस दे दें, ताकि जो अपना फॉलिक एसिड है, आयरन है, या फिर विटामिन 12 की जो डिफिशियंसी है, जिसके कारण एनीमिया वगैरह या फिर चाइल्ड में माल न्यूट्रिशन का जो प्रॉब्लम रहता है, वो हम ओवरकम कर सके। तो ये ओवरकम करने के लिए गवर्नमेंट ऑफ महाराष्ट्र ने सेंट्रल गवर्नमेंट की जो गाइडलाइंस है उसके हिसाब से काम करते हुए 2019 से लेकर 2024 तक डिफरेंट फेजेस में ये प्लान एक्टिवेट कर दिया है। और 2024 में हम जो 24 से हम पूरे महाराष्ट्र में फोर्टिफाइड राइस डिस्ट्रीब्यूट कर रहे हैं। और हमारे यहाँ पे अब ऐसा एक भी बेनिफिशियरी नहीं है कि जो गवर्नमेंट ऑफ महाराष्ट्र या सेंट्रल गवर्नमेंट की ओर से जो चावल ले रहा है डिफरेंट स्कीम के जरिए, जैसे कि पीडीएस फॉर ऑल ओवर द पीपल्स, आईसीडीएस फॉर द स्कूल्स, या फिर मिड डे मीलिंग, या फिर हमारे जेल में वगैरह जो कुछ कैदी रहते हैं उनके लिए, सब जगह पे जहाँ पे हम चावल दे रहे हैं, वो हमारा एम है कि 100% हम फोर्टिफाइड चावल ही दे दे। और हम ये फोर्टिफाइड चावल 2024 से पूरे महाराष्ट्र में डिस्ट्रीब्यूट कर रहे हैं।
एब्सोल्युटली कमेंडेबल वर्क महाराष्ट्र ने बहुत अच्छा स्केल अप किया है, जिसमें 100% फोर्टिफाइड राइस डिस्ट्रीब्यूशन। एंड इन द लास्ट ईयर जो मैं देख रही हूँ खुद डिपार्टमेंट के साथ बैठ के, द वे क्वालिटी वाइज कितना इम्पैक्ट एवरी मंथ कुछ ना कुछ नए एसओपीज आते हैं, उसका इम्प्लीमेंटेशन होता है। कमेंडेबल ये है कि राइट नाउ कमिटमेंट ऑफ द गवर्नमेंट वी कैन सी right now both Patil sir and Sushant Patil both are en route from a meeting from FCI back and they are joining this. तो हम देख सकते हैं कि गवर्नमेंट कितना aligned है with the overall aspect of delivering the quality of it. So I'll take the question to Dr. Jagmeet Madan now that we've understood why it has become relevant, it is conducted. मैम आप ये बता सकते हैं लाइक बेसिकली आप अकॉर्डिंग टू व्हाट इज द साइंस बिहाइंड राइस फोर्टिफिकेशन, एग्जैक्टली कौन से न्यूट्रिएंट्स ऐड हो रहे हैं, हाउ डू वी इंश्योर कि उसका स्टेबिलिटी ड्यूरिंग कुकिंग रहे. So from a nutritional point of view, for iron, folic acid or B12 or other nutrients, why are they added, and इनका stability क्या कर सकते हैं, या other aspects also.
So thank you, Nandita, for that question. I think जो 3 important nutrients डाले जा रहे हैं राइस में, it is iron, folic acid and B12. And जैसा आपने कहा कि वो प्रीमिक्स फॉर्म में स्टैंडर्डाइज किया गया है. So we are very clear how much is getting added. And another aspect which has also been taken care of is the form of the iron. Which is, we know that ferrous and ferric are the 2 forms, and it's the ferrous form which is more easily absorbed and utilized in the body. So the salt which is used in the FRK is aligned to favor absorption of iron. And I think the ratios of these 3 micronutrients are also kept in mind. So that the nutrient adequacy is met. To a great extent, it is mentioned in the literature, and what I have learned from you all as well, that key stability of FRK is pretty high in terms of loss of nutrients. Like हम rice में FRK को mix करते हैं, right? In a certain proportion, and जब हम उस राइस को कुक करते हैं तो some of the technical difficulties which we had earlier कि जब, because normally घर में whenever you cook rice you will soak the rice, and अगर soaking में ऊपर उठ के आ रहा है rice, you may feel that this is a rice to be thrown away. And वो एक दिक्कत हमें आ रही थी, which probably also has been kind of taken over. Now I think we have matched the density of the rice grains and वो इतना नहीं हो रहा है. And दूसरी एक और जो practice घरों में है कि you boil the rice and you discard the water. ये बहुत लोग करते हैं कि starch कम करने के लिए I will discard the water and I will use the rice. But again, from the nutrition standpoint of view, iron, folic acid, B12, these are all water soluble vitamins. So चाहे हम कह रहे हैं कि FRK में we have tried to ensure that the stability of this is there, but still by doing this practice, like I remember when we were talking about iodized salt supplementation, हम families को ये भी बोलते थे कि normally हमारी practice क्या है, हम सबसे पहले नमक डाल देते हैं in our वगार. Like प्याज टमाटर डाला, उसके साथ में ही आपके मसालों के साथ नमक डल जाता है. So iodized salt की भी ये limitation थी कि अगर it's a volatile micronutrient, so if the more you expose it to cooking, there will be more losses. So this is a behavior change, a change to say कोई फर्क नहीं पड़ता है कि मैं लास्ट में salt डालूं या मैं शुरू में डालूं, but it's the way we treat the food. So ये चीजें, and especially मैं इसलिए बोल रही हूँ because the students who are listening to me, they're all the budding nutritionists. You talk to patients, you talk to people at large. So ये छोटी छोटी चीजें you have to say कि whenever you're cooking rice, please do not discard the water. और जब आप धो रहे हैं, धो के आपने soak किया, वो soaked water आप use कर सकते हैं. You don't have to discard that water. And plus, we also know, again, as nutrition students, we know that iron, what are the factors which favor iron absorption? So we know that vitamin C is a very important promoter of iron absorption, to the extent that we have seen, जहाँ पे, इसलिए मैं diet diversity की बात कर रही थी, there have been studies that just the addition of one guava, along with a meal, which is the dense source of vitamin C, has favored the absorption of iron. So body doesn't treat only an ingredient, body treats the food in totality. So understanding all this has a meaning. And to my mind, and B12 becomes very important for us because many of us are, vegetarians. Majority of Indian population is vegetarians, और non-vegetarians भी vegetarians हैं. Like वो भी इस हफ्ते में एक बारी non-veg खाते होंगे. तो B12 की डेफिशिएंसी थोड़ी रैम्पेंट हो गई है, एंड प्लस अपना हमारा माइक्रोबायोम भी इफेक्ट हो गया है बिकॉज द काइंड ऑफ food which we are eating, the B12 is also synthesized in your gut. So that synthesis has also got impacted. And folic acid, we know for sure, is needed, for your cell regeneration and specifically in crucial phases of growth. So that's where, when we are making this rice reach the young children, the pregnant women, I think these are very, very important group. They need to get folic acid. Again, I come back to iodine. Like for pregnant women, iodine was such an important micronutrient, because if you would not pay attention to that micro amount of that nutrient not provided to the pregnant women, she would probably, end up having a compromised fetal outcome. The same applies to here. So all this has been put together. But like I said, using the vehicle correctly is very important, and that is where the practices which I just mentioned, soaking and throwing the water, boiling and again discarding the water, and as much as possible combining rice with a protein source, so that you are, in totality improving the protein quality, looking for a vitamin C rich source coming in your meal. So all these efforts will in totality help, this endeavor. इतना effort करके जब हम उस vehicle से आपको nutrient दे रहे हैं, so we have to support, nutritionists have to support with this. बहुत बारी हमको लगता है ये क्या बात करने की चीज है, like, but I feel we must point out these small things because people at large do not know this.
Yes, yeah, absolutely, yes. So thank you for bringing in so many things. And in addition to that, Dr. Siddharth, I want to ask you, like, as we put in so much effort towards fortification initiative and all the nutrition related education, कि उसमें protein भी add करें हम, vitamin C भी add करें, a lot of things put on forward. So how are experts going to assess whether implementation of all of this happening by the government, by academia, by technical partners, we're putting together so many efforts, how would we assess the effectiveness of fortified rice in the community at large? How would we know if our efforts are going in the right direction, or do we need to, so is there a way experts assess this effectiveness?
Sure. So, I mean, as I understand your question correctly, I mean, what you're asking about कि आगे चल के हम लोग इसके बारे में, how can we assess that whether it's being impactful or not? So just to give you some context around fortified rice as such, before it was being launched into the public safety net schemes, there has been ample evidence available around fortified rice. There are around 22 scientific evidences which have been published in proper peer-reviewed journals as well, and which have shown the efficacy of fortified rice. And when I talk about, say, the efficacy of fortified rice, primarily we are talking here about two parameters largely. We are talking about serum ferritin, which is, say, the body iron stores, or say serum transferrin, which is basically the protein which is carrying hemoglobin. So primarily we are looking at these two parameters, because अगर मुझे आप ये कहो कि मैंने आज fortified rice खिलाना शुरू कर दिया, or within, say, the next 1 week, I want to see improvement in my hemoglobin levels, that's not going to happen. It's not a magic bullet. We need to understand that. Fortified rice जो है बहुत ही minute doses में आपको जो है micronutrients provide कर रहा है, and gradually over a period of, say, 6 months to 1 year, it's going to build up your body stores of the micronutrients first. And then gradually it is going to impact your hemoglobin levels and thus your, say, anemia or public health prevalence issues as such. So, as such, when we talk about the efficacy, there is evidence which is available. In fact, if you look at a paper by the NIN and ICMR, which is put together, it's a white paper which has been put together, which clearly shows that, fortified rice as such is a, say, very effective medium to improve body iron stores of, say, in humans, and also it's safe and cost effective is what they have very clearly put together. And likewise, if you see say a meta-analysis which is put together by scientists from AIMS, they have very clearly said that for countries which consume rice, fortified rice is a very good medium to improve body iron stores. And when I'm talking about efficacy, I'm largely looking at body iron stores only. But going forward, if I talk about, say, what are the evidences, या फिर अभी हम क्या research कर रहे हैं जिससे कि हमें पता चले कि what is, the impact of fortified rice consumption. So, I mean, in the next few months, we will also see a paper which is being published by, say, an independent agency who assessed the WFP pilots in Malkangiri and Chandauli. It's also a paper which is under publishing and is being peer reviewed. So, वहाँ पर what we have seen that, in Malkangiri, the prevalence of anemia amongst non-pregnant women has gone down from, say, 48% to around 40%. Whereas in Chandauli also, which is a district in UP, it has gone down from 71% to 65% within a duration of about 12 months or so. So that's a paper which is being published. Likewise, if I see what are the national level studies which are being done around this, so NIN ICMR, which is the premier organization for nutrition in the country, so they are doing a study across 6 different states in the country, which includes Maharashtra, which includes Gujarat, which includes Assam, Himachal Pradesh, Uttar Pradesh, and Telangana. So इन्होंने हर एक स्टेट में एक एक डिस्ट्रिक्ट चूज कर अलग अलग populations पे they are looking at impact. So currently the baseline of this study has already been completed. And now as we look at around in December 2024 में baseline इसका complete हुआ है. This year we're looking at the endline assessment also coming up. And we will certainly have data from this nationally representative study coming out soon as well. Likewise, based on the similar methodology, WFP along with its partners is also doing a study in 3 states, which is Uttar Pradesh, Chhattisgarh, and Andhra Pradesh. We are working along with the St. John's Institute of Nutrition in Bangalore, and along with them, there's again this study which is coming up. So these are some of the nationally representative, or say, studies which are coming up. And we also would have the dietary and biomarker survey, DABS survey, which will be done by NIN, which will also look at the improvement in, say, some of these indicators like serum ferritin, transparent, and so on, which will also give us evidence around, though if we may not be able to directly attribute it to, say, fortified rice, but certainly it will show you improvement in, which parameters have sort of gone down and which parameters have come up. So these are some of the nationally available surveys which some of the researchers or some of the policy makers can look at going forward.
That's good to know that we'll be understanding it in a structured way. Also, in Maharashtra, Bhandara was one of the districts jahan se we all of this data has been collected, which will represent the western region, and independent agencies, when they are doing together, it will be great to know that all these results are speaking to each other, so we know that koi biases nahi hai, koi regional specifications nahi hai, which is a good way to assess, and we'll be able to know where changes are to be done. So with that, I want to understand, based on your experience of working with so many different states, there'll be certain things which you would probably see as a challenge across, common challenges across in scaling up fortified rice. So what do you think have been challenges that have been, which have come up, which have been resolved, and there would be something which are still under resolution? So it is good to know about challenges.
Yeah, thanks for asking me this question, because again, when people talk about अभी scheme इतना grand scale पे reach out हो रहा है, people think that there are no challenges as such, there are no issues. So I would not say that there are challenges, there are implementation level issues. Like सबसे पहला basic conceptual, if I were to talk about a conceptual challenge, rice is a staple for 65% of Indians. Now, what about the remaining 35%? For them, rice, because if I talk about states like North India, mein Punjab ho, Haryana mein ho, they don't consume rice there. They consume wheat. So we need to look at alternative strategies like, wheat flour fortification, jahan par rice will not be an effective medium, but wheat will work out better. So like as you mentioned, wheat flour fortification would be a better strategy. Likewise, if we look at some of the tribal areas, again, there millet consumption is primarily being done. So, how can we look at other strategies which are, say, biofortification for that matter, or say, nutri gardens or something, which can improve nutrition level among some of these populations as well. So we are looking at some of these interventions as well, and not only solely depending on fortified rice as such, because that would lead to some of our operational challenges there. The other thing that I'm talking about is, say, राइस ट्रेडिशनली अगर मेरे घर की भी बात करो तो मेरे घर पे भी यही होता है। जब घर पे चावल आता है तो सबसे पहले चावल को धो दिया जाता है। आई मीन देयर इज अ प्रैक्टिस ऑफ वॉशिंग राइस, एंड व्हेन वी वॉश दिस राइस अगेन जो फील्ड में मैं चैलेंजेस देखता हूँ, बिकॉज समटाइम्स दीज कर्नल्स माइट फ्लोट इन वाटर. So what happens is that people pick out these kernels and take it out. So the whole purpose of fortified rice being there is sort of defeated. So with this channel, of course, and of course, I would like to we've also been working on that, is to how can we improve awareness in people so that when they are washing rice, this practice of discarding kernels sort of is taken care of. So that is another issue. And the third thing is, we also already touched upon it in a way, was that if fortified rice is being cooked in, say, excess water, we don't discard that water. So we'll have to take ample amount of water so that जितना राइस हमने लिया है उतने में ही पानी पक जाए और पानी फेंकने की जरूरत ना पड़े. Like what we call as a water drain method. Because if you are discarding all the water, आपके जो vitamins water soluble है वो सारे उसी में निकल जाएंगे. So those are three some of the, say, challenges, I would say. Of course, monitoring and the quality assurance, these is because since fortified rice is a new scheme and being implemented at such a large scale, we are also learning, and the program implementers are also learning. So gradually, we are seeing that there's improvement in the quality, there's improvement in the monitoring, there's digitization being brought on everything. So these are things which are being taken care of. But yeah, these are some of more or less the operational challenges that we see here.
Yes, I just want to add here, Nandita, what Siddharth said. See, the purpose of having this kind of webinar is also that, I mean, every child who's attending this seminar has a family, through the family, through family friends, so it's like one person educating the other, and, disseminate, even the people who come and help you at your home. Like, this kind of conversation can happen with them as well, because now that government is trying to cover the entire nation, that's something as simple as that, you don't throw away the water in which you soak the rice, you don't drain away the water, don't take out the kernels and throw. These messages have to be reinforced again and again, and each member who's listening to us can contribute. Yeah.
So,
sorry, Nandita, just to add on to what Dr. Madan has mentioned, that, Dr. Madan, precisely my point, because, this was the first conversation, in fact, that I had with my cook here in the house, because she's a recipient of, say, the PDS chawal. And then she, just once upon a time, while a conversation with her, उसने मुझे बताया कि ये कौन सा चावल आ रहा है, इसमें तो प्लास्टिक है. So, it started at home. And I'm happy to say that now my cook has learned to, how to make fortified rice and, consume it and appreciate it as well.
No, so that's so wonderfully said, of course, that you've put together one, that you've made some change yourself at your home. So at least one person moved. And then, of course, there's a lot of diet diversification. We are seeing बहुत diet different ways of even the same rice को consume करने के भी बहुत सारे techniques हैं. Some people are eating it as bhakri, some people are eating it as a broken rice. So that, I think, challenge what I feel in a country from my point of view is good or bad, whatever, but the population also is a large, and the diversity and all of that. So implementing any one thing is not fitting all states. So although Government of India ने अपनी तरफ से एक backbone type का structure दिया, all states are now building up on that. So वो structure लेके what works best for our state, and in a state like Maharashtra itself, 36 districts are also so varied. So from a Ratnagiri to a Gadchiroli, we can see so wide disparity. So with that, also I want to understand, if Sushant is still here with us, I want to understand from your point of view, चैलेंज आपको क्या लगते हैं इन इम्प्लीमेंटिंग, बिकॉज आप फर्स्ट हैंड इम्प्लीमेंट कर रहे हो इसको, प्रोग्राम को, with all of those SOPs? What are the challenges that you think in implementing fortified rice in in a state which is as disparate, itna different hai? What are the real grassroots challenges that you've seen? Sushant? Dr. Radha, is the government of Maharashtra is
I cannot see him in the meet. Maybe there's a
dropped and
technical
he
issue
joined
or
back.
something.
They are
Yeah.
traveling, so probably they have. So
Yes,
I'll take this
yes.
up with them again if
Yes. So
here.
you can have other questions to the panel.
Yes. So going forward, I want to understand also, from a point of view of awareness. Now that we've come on the aspect of the importance and all of that, what I took as a issue myself, as I saw, was awareness. And how do we build awareness among beneficiaries, like overall, from the of benefits of fortified rice, and also to address misconceptions, because although it's a very small thing that fortified rice is being given, but we see a lot of pushback also from beneficiaries. So what is the ideal way of building awareness?
Okay, so I think to my mind, the closer we go to the people, the better will be the implementation. So there's something which is conceived centrally, it is percolating in different states, and you said within states there's so much diversity. So I think and each state has a particular kind of rice which they consume, and if I'm not mistaken, Siddharth, you can correct me, the when they make the kernels, I think they pick the rice which is most commonly consumed in that region to make the kernel, right? Just add light to this. Can you elaborate on this?
Absolutely, absolutely. So whenever we are building or say developing kernels, the base rice, as in अगर मुझे बासमती चावल में fortified rice kernel बनाना है, तो मैं उसी चावल का, so that the density across of the kernels remains more or less the same as with the base rice. अगर मुझे सोना मसूरी चावल का करना है या किसी और ब्रांड चावल का करना है, so I will use the same rice as the base rice for developing the kernels.
So that is one, and you very rightly said that people use rice in different forms. वो खाली चावल को चावल की तरह नहीं खाते हैं, like they may be combining it with other ingredients, or they may be even expecting certain functional qualities. Like अगर मैं एक rice को बिरयानी के लिए use करती हूँ, then I expect that identity of the grain to be maintained. So am I achieving that when I'm using this fortified rice? So I remember I was in a forum where I was talking to people from NIFTEM, and they're doing some work, and I said, ki, using fortified rice for different cuisines, and to what extent you are closer to what you want in a given preparation is also a parameter which will govern whether you want to use the rice in your cooking or no. So that was one. And but so that's precisely what I'm saying, that the more we India may, one size cannot fit all. We have to go with this assumption, and that is where implementation of a scheme in a country like India becomes so challenging, because her population, her state, her district के challenges अलग हैं, and उन लोगों को साथ में लेके, इसलिए जो ग्रास रूट लेवल पे लोग काम करते हैं, आई थिंक दैट इज वेयर द मेन स्ट्रेंथ हैज टू कम. And the more we understand the population, these small nuances we can pick up, and we can succeed in making sure that इतना बड़ा जो हम प्रोग्राम कर रहे हैं, it should trickle down at the bottom, and people should reap the benefits.
Okay.
So, and I think educational institution like ours can play a very important role because sensitizing each stakeholder, uh, keeping in mind what messages they should get. Again, like you do a baseline detailing or scoping of understanding the dietary pattern, and then coming out with those messages, and then working with the stakeholders and giving those messages. I think these are very, very important steps. So we are very happy that we are contributing in our way. पर मुझे ऐसा लगता है कि अगर हम किसी जैसे अभी सिद्धार्थ ने बोला, he could sensitize his own maid, even that is a success story. So I don't think so we should sideline some of these success stories. Each one of us can create success stories starting from ourselves, our own home, to our families, to our society, and then reach out to these places and contribute. I think हमारे यहाँ पे कितने बच्चे हैं who come from different districts of Maharashtra. So they can volunteer for themselves. Ki, okay, I will work in my district and I will work with those stakeholders and make sure that some of these myths are broken or correct messages are given. So I think that's the way forward.
Very rightly said, Dr. Madan. And also, I feel that, of course, so for webinars like this, it becomes essential that we are also doing awareness for people who do not have a ration card or who are not getting fortified rice from the government directly, but still how they play an important role in overall awareness is like people who do not have, but they know people who are getting. So if we know ki, okay, ration shop में fortified rice दे रहे हैं, so if we meet anybody who's not aware, we will tell them, okay, we are not getting, but you are getting. So that is how webinars will become important. And Dr. Siddharth, based on your experience of working with other states, like what are the different awareness initiatives which states have taken, which have worked wonderfully with the awareness? So
Yeah. Thank you for that question. And before I actually answer on to this question, I also wanted to ask the audiences who are here that how many of you have seen the fortified logo? So Government of India in 2017 or 2018, they came up with this logo which symbolizes fortified foods. जैसे आप एक वेज लोगो होता है जहां पर आप ग्रीन आप डॉट देखते हो, likewise you have the brown logo which signifies non-vegetarian foods. Similarly, the government of India has come up with a logo which is used to indicate fortified foods. So, and fortified rice की बात करूं मैं, like when we talk about working with different states, that is what we've exactly tried to leverage, the making people aware about fortified foods through use of the fortified logo as well. And there are different strategies and the ways in which we do it. We are focusing on behavior change communication by producing, say, awareness videos, and there are multiple videos that the World Food Program has developed. These are all available on the YouTube and some of the social media channels as well. There are posters. I'll give you an example of, say, the state like Chhattisgarh. What we've done in Chhattisgarh is that जो आपका राशन कार्ड है, राशन कार्ड के जो कवर पेजेस होते हैं, front side you will see that the government is talking about their own schemes and the government themselves. But on the back side, when you go to the cover page of the ration card, you will see that वहां पर fortified rice आपको दिया जा रहा है. And this is just like if somebody reaches out to the cover, they will themselves see that आपको कौन सा चावल मिल रहा है, इस चावल के क्या फायदे हैं, and in their own regional languages. So simple measures as these, which are being taken up by different state governments, and that is just one example that I'm talking about. Likewise, जो ICDS स्कीम है या फिर जो PDS स्कीम है या फिर MDM स्कीम है, इन स्कीम्स के जरिए भी we will see that we have done multiple activities around, say, introducing posters or putting up banners around fortified rice in schools, in different public areas as well, like community health centers and everything. And it's not just one strategy that we are looking at. It's all hands on deck. Like Dr. Madan mentioned that each one of you is a contributor, and in your own way you can also contribute to this cause of making people aware about fortified rice. A simple thing like जितने भी हमारे फ्रंट लाइन वर्कर्स हैं, आंगनवाड़ी वर्कर्स, आशास एंड एएनएम्स, इनको फोर्टिफाइड राइस के बारे में अवेयर कराना बाय डेवलपिंग कंटेक्स्ट स्पेसिफिक मॉड्यूल्स अराउंड फोर्टिफाइड राइस, विच आर लाइक इन द फॉर्म ऑफ स्मॉल वीडियोस स्निपेट्स या तो सिंपल पोस्टर्स फ्लायर्स की तरह, जो कि वो व्हाट्सएप से अपने जरिए देख सकते हैं. वी पॉपुलराइज आवर वर्क थ्रू व्हाट्सएप एज वेल. So those are mediums which can make people aware about, fortified, especially the frontline workers. One important aspect that I would also like to mention is that our partnerships with academic institutions like SVT, and then, likewise, we have partnerships with other premier organizations within the country as well. So these partnerships are a very good medium of, say, making students aware, like, the academia and their students about fortified rice. Fortified rice kya hai? And just, because students who are budding nutritionists, who are budding doctors, and, aage jaake, these are going to interact with the community. So if we start right at the level where, the students are getting educated, that is where, we see this as a very big positive movement, which gradually चल के आगे 2-3 सालों में it's going to come out, and people are going to be more aware about it. So that is where I really value these partnerships that we have with the premier academic institutions in the country. And yeah, I mean, more or less, I mean, that's where, I mean, you'll also see that there's a lot of media coverage around fortified rice. You would see that, there are experts talking about fortified rice. So recently there was a article by Dr. Amrish Mittal, who's one of the very renowned endocrinologists in the country. He's in fact the Prime Minister's doctor as well. He talked about, how fortified rice can be efficacious. So similarly, there are these different mediums that we also look at, and in a way try to work with different states. And whichever context, जैसे context specific होता है, जिस state में जो context work होता है, तो we work according to that.
Very rightfully said, Dr. Siddharth. Also, we've seen a lot of negative publicity come in from videos and reels and WhatsApp and YouTube, and leveraging the same things to now create positive awareness has become the thing that most of the states are taking up, because people get influenced with all these reels and YouTube videos, especially the younger population. It goes so fast. So it is good that all the states, as you said, have taken up videos and they're circulating there in their YouTube channels and their WhatsApp groups itself. And there's one interesting thing that the government of Maharashtra has done, which I saw, is the posters that they created for the schools and for the fair price shops and for ICDs. All of them are speaking to each other, which means that midday meal के पोस्टर में उन्होंने लिखा है कि राशन की दुकान में भी चावल मिल रहा है, वो फोर्टिफाइड है. फोर्टिफाइड शॉप में लिखा है कि जो मिड डे मील में चावल मिल रहा है वो फोर्टिफाइड है. सो दे नो दैट ओवरऑल ऑल द राइस. सो इट्स अ गुड इनिशिएटिव दैट कन्वर्जेंस. इट्स नॉट दे वर्किंग इन साइलोज. Everybody knows that यहाँ पे भी चावल fortified है, वहाँ पे भी everywhere fortified चावल है. So that's one. And as we go forward with the question on overall to future outlook, there is one question by a student which I'll read out. It's about if we use soaked, and this is for Tahura Tahir. Tahura, are you here? Tahura, I'll read your question and I'll leave it to the panelists. So it's she's asking if we use soaked water or not do proper soaking of fortified micronutrients and rice. Rice may contain some anti-nutrients, and anti-nutrients will not remove properly. Then what can we do for retaining So I think a question is around the aspect that that if there's a practice of soaking rice before cooking, and if they don't do it, the anti-nutrients will not be thrown away in water, and if they do, then the micronutrients will go. So there's a conflict. So how do we do that?
So let me answer that question. I don't think so. Rice in particular has any major anti-nutrients. In fact, among cereals and millets, the lowest amount of any anti-nutrient which I can think of in rice is, I mean, it's negligible, I would say. And soaking of rice is not done to eliminate the anti-nutrients, but soaking of rice, to my mind, how much I understand, is essentially to, maybe reduce the cooking time, or sometimes people, like I said, told you, throw away the water in the anticipation that, they would remove the starch and the rice will be low in calories.
Right.
So, okay. So all those kind of things. And but I don't think so. It has any anti-nutrient content which is interfering in the micronutrient availability. Yeah.
Right,
If
absolutely.
there's anyone here who wants to contribute to this answer, my colleagues are here. So I would be very happy. You can add.
Dr. Siddharth, would you like to add in something for this?
Yeah, I mean, just in case, like, we're talking about polished rice. I mean, primarily it is polished rice. So whatever anti-nutrients were there, it's also reduced to a certain extent also. I mean, it's gone down. The other thing is also when we develop fortified rice kernels, and when we're talking about fortified rice as such, in the fortified rice kernels, you have overages of vitamins which are also built in to account for some of these parameters, like washing, some of these, like if you're heating, or say some of these activities. So overages are built in. So that takes care of whatever losses, or say some of these losses. But still, for having a much beneficial impact, we suggest that it should be a watertight method of cooking, and it should be, I mean, the water should not be discarded away. That is what we suggest.
Yes.
I think
Not whatever.
I think I'm reading her questions. She's saying that people have a myth कि जब हम किसी फूड को फोर्टिफाई करते हैं तो हम उसमें केमिकल्स ऐड कर रहे हैं. So this is the myth people have. The fortified foods are bad. This is what she's saying.
I think that's a different question by Nishant, which will come to.
I think I just read that question.
Yes. So Tahura asked earlier, and I think what you said is absolutely correct, Dr. Madan. Rice itself, when we talk of white rice, probably brown rice or parboiled rice may have some, but white rice is completely starch. All the anti-nutrients which are there in the bran level are removed at the milling process. So there are no anti-nutrients. So absolutely right. People soak it for the purpose of reducing the time of cooking or lesser water to be used and all that. It is not basically for anti-nutrient removal as it is done in dals and other things. And again, as Dr. Siddharth said, that अगर है भी थोड़ा बहुत तो एक्स्ट्रा डालते ही हैं कि अगर वॉशिंग के टाइम पे थोड़ा बहुत निकले तो वो ऑन एन एवरेज उतने ही रेंज में आ जाए. So that is absolutely correct. The second question is from Nishant. And if Nishant is here, and Nishant, again, as you ma'am asked, is where fortified with vitamin minerals from which form? Fortified products are more chemicals. Okay. So basically these are micronutrients. So again, I'll leave it to you and Dr. Siddharth this question. Do you think that what is the form, as you already have mentioned the form of it? And do you think it is chemicals or it could be harmful?
No, I don't think so. These are very, very standardized, researched formulations. आप multivitamin की जब pill खाते हो, so it's a standardized product, right? It is not a chemical which you're consuming. It's because you're adding that to your diet because you need that extra bit of that nutrient. Similarly, this is an endeavor to add additional nutrient to a food vehicle. एंड जो FRK का स्टैंडर्डाइजेशन होता है उसमें क्या न्यूट्रिएंट हम डाल रहे हैं, किस फॉर्म में डाल रहे हैं, कितना डाल रहे हैं, उसकी कंपैटिबिलिटी क्या है फूड के साथ. इट्स अ कंप्लीट साइंटिफिक डिटेलिंग और ये होने के बाद उसे स्टैंडर्डाइज किया जाता है और FSSAI जो आपकी सुप्रीम बॉडी है जो आपको रेगुलेट करती है उसका अप्रूवल मिलता है. और जैसे अभी नंदिता ने बोला अभी तो पूरे इस फोर्टिफिकेशन को इट इज सेंट्रली गेटिंग मॉनिटर्ड. मतलब वो पूरी जो उसका कहाँ कौन कौन फोर्टिफाई कर रहा है, कौन FRK बना रहा है, उसमें लेवल है कि नहीं, ये पूरा सेंट्रली मॉनिटर हो रहा है थ्रू स्टैंडर्डाइज लेबोरेटरीज. सो आई डोंट थिंक सो. इस चीज को तो आप पहले ही अपने दोस्तों और अपने रिश्तेदारों को बोलिए कि दिस इज अ कंप्लीट myth to say कि ये chemicals हैं. These are not chemicals. These are nutrients which are beneficial for you. Yeah, Siddharth, you want to add something?
Yeah, I think to your question, Nishant, I would suggest read up the ICMR and NIN का जो white paper है around rice fortification, 2023 में ये white paper आया, and it exactly addresses some of these concerns where you're talking about, say, chemicals है तो क्यों safety है या नहीं है, and all of these things. So you will get answers to that specifically. And if you're doing it on, say, a thesis basis or something of that sort, वो exactly आपको उस चीज पे सवाल सारे मिल जाएंगे. But as Dr. Madan mentioned, these are pharmaceutically approved formulations, and these जो FSSAI के guidelines के हिसाब से बने हैं, या फिर these are all within norms, and it's not harmful. I mean to say that, yeah. To come to your question, it's not harmful.
Yes. So yeah, Nishant, I think you've got your answer. To add, just to sum it up, I feel the what is added is micronized ferric pyrophosphate, and as we say from a nutrition point of view, from policy, whatever, but as a nutritionist, I'll tell you that having iron from a spinach will always be better than having iron from a pill. That is true, but people are not consuming it. We are doing fortified rice as an initiative now because people have not been consuming rice in its consuming iron in its form of food. And why they're doing it is something we can have another 1 hour panel discussion on, so we'll not go there. But to sum it up, the reason that fortification हुआ है वो is only and only it's a supplementary thing. It is done because लोगों ने consume नहीं किया, और people who will consume fortified rice के साथ spinach will even be beneficial. But जो नहीं भी spinach का सब्जी खा पाएंगे या कोई iron form या कोई भी चीज खा पाएंगे, वो at least rice and दाल भी खा लेंगे तो उनको कुछ iron मिल जाएगा, is the entire concept and idea. So with that, I think we'll close this panel discussion. Wonderfully, we've had this conversation.
There is one more question, Nandita. Are
Okay.
fortified rice safe for thalassemia patients? That is one question that Archie Banashali has asked.
Okay, Dr.
So-
Siddharth, would you want to take this? Because there's a lot of to and fro that has been done on thalassemia and sickle cell anemia.
Absolutely, absolutely. And thanks for asking this question. So yes, fortified rice is safe for patients with thalassemia as well. And I mean, पहले अगर आपको, I mean, if you've been looking at the work around fortified rice, जब fortified rice के standards launch हुए थे in 2018, the government of India went with a normer or say a warning saying that patients with thalassemia may take it under medical supervision. But over the next few years, there has been research which has been done, and एक डॉक्टर याजी इटालिया करके है, who's a Padma Shri awardee, and he's based from Gujarat. He has done a lot of work around thalassemia patients in Gujarat, and some of his research and also some of the research from other scientists around the country has shown that if you give thalassemia patients feed fortified rice, I mean, you feed fortified rice to them, it's not going to have any negative effects on them. And if I were to just explain you in a very small nutshell about, why it's not going to have any impact on them, or say, any negative impact, is because, say, thalassemia patients को iron overload कब होता है? When you sort of give them any, say, blood as such or blood transfusions. That is when they are getting about, say, 250 grams of, say, iron as such through the blood transfusion that they're doing. That is when they end up with iron overload. But your fortified rice का जो dose है, that is just about 2 to 3 milligrams in a day. And it's just about 30% of your RDA requirements. So with that small or a micro dose, it's not actually going to, have any issues such as iron overload, but rather thalassemia patients are also seen to suffer from anemia. It's going to help them improve their anemia levels. It's going to help them improve in a way from that particular prevalence deficiency of iron that they have. So that is where it's safe. And there is again that paper that I referred to for the previous question as well, that ICMR NIN का जो paper है, उसमें ये सारी चीजें, white paper of 2023, and if you just Google it up, you will find this paper as well. So it has all of these questions which are also addressed. So if you see the,
Siddharth, I would request कि अगर वो it's a good
sure,
paper, you can share it with all of us,
yeah,
and some of them, like all the participants, will have their email. We can share it with them. Not a problem.
certainly, I'll share that with along with everyone.
So thank you, Dr. Siddharth and Dr. Madan. So as we close this panel discussion, very thought-provoking, what is one single statement or word closing, answer that you would give to a priority action that you would want to accelerate rice fortification? If I have to just ask you, it is something that comes on the top of your head. So
I would say start talking about it. Start talking.
Right.
That's where that's where you begin. I mean, starting from your family and go one step forward and see how you can contribute.
Dr. Siddharth?
Absolutely. My one word is also awareness. That itna jabki scheme government of India has launched it and it is making so many efforts to improve nutrition. We must certainly make advantage of it and make our country malnutrition free. And not just say people who are receiving fortified rice through the food safety net scheme. Fortified rice is also now available through your commercial markets as well, through different brands as well. So we should certainly utilize some of these facilities. Thanks.
Awareness is something that we take away from this, and thank you so much to the panelists and to everybody who's joined here. I will pass this to Dr. Anuradha right now and to take this on further.
To the most exciting
Thank you, Ms.
part.
Nandita. Yeah, it's a wonderful panel discussion, excellent panel discussion, and kudos to the moderator also for effectively taking it through. I think the three main points, the need for fortification, the scientific evidence, and the challenges and the policy initiatives that we have discussed very well. And it has been given very well. And we had very thought-provoking questions also from our participants. And just a request for all the participants, if they have further questions, they can still send it to us and we can have the experts to answer them as well for the same. And thank you, Jagmeet ma'am, Dr. Siddharth and Nandita for moderating this particular session, and the participants for asking and listening to this particular aspect as well. We now move on to the very exciting aspect of today's webinar, and that is the declaration of the results for the essay competition as well as the poster competition. I will request Dr. Panchali Maitra to
Yeah, good evening, everybody. Till the time the screen is getting a little more live. It's been also listening to all of this conversation, and I seeing it's 8:40 in the evening, Monday evening, 80 students. It's difficult for us to hold them in a class for 50 minutes, 90 minutes, and now we're holding their attention for 2 hours. So it's a big round of applause for everybody who's been present here. So heartiest congratulations.
I take this opportunity, Dr. Panchali, to introduce you as well.
I think we can skip it, Anuradha.
I'll just a little bit of an introduction. It is Dr. Panchali Maitra is our faculty academic dean for postgraduate programs and research, convener for R&D and PhD center. And she has varied research interests, as she has also worked in a lot of international projects. And she has received Governor's Award for Research Excellence for School Nutrition Education Project. She has received various conference grants and travel research. And she has published more than 40 plus papers in peer-reviewed journals. And she has also been associated with this particular organization of the competitions, as well as has taken part in terms of the evaluation. So we have had panelists who have done this particular evaluation, and we have Ms. Apurva Surve, who has also evaluated these particular competitions. Over to you, Dr. Panchali, for announcing the prizes.
Great. Thank you so much, Anuradha. And I know this is the much anticipated segment of today's webinar, but I would say that overall, this has already been a very successful event. And we've had some amazing discussions, speakers, panelists, a very engaging webinar. Along with an applause for the experts and the panelists, I think a huge round of applause is also due for each and every participant of the competition. I and Apurva had the pleasure of going through 40, 45 posters, a similar number of essays, which were evaluated rigorously by the entire team, Dr. Anuradha, Dr. Nisha, me, Apurva. And a huge congratulations to each one of you for the creativity, effort, passion that you all have shown. And trust me, it was absolutely amazing for us to see the visual display of the posters and also the thoughtful and informative ideas that are put together in the essay here. I'll just take a few minutes to tell other people who are attending here what this conference, what this entire poster competition and the essay competitions were. So, over the last 3-4 months, we had launched a national level poster competition. The theme for the poster competition was fortifying rice, fortifying futures, and we were trying to see how students engage with this large scale rice fortification and put together their innovative ideas for scale up and technological advances and solutions to all the challenges that were discussed today and are already understood in this rice fortification ecosystem here. This poster competition was also a way for us to engage with the larger student body, who, as Dr. Madan said, are the ones who would be bearing the torch and taking it forward and taking the mandate of rice fortification and the success of this huge national initiative ahead here. So this was also a means for us to foster awareness about the role of fortified staples in improving population health outcomes. I know everybody is waiting with a lot of efforts and all ki okay, ye sab to theek hai. What is the next? So any guesses, if I may ask, for the winners for poster competition? We actually were thinking of giving 3, but then we had 40, 45 entries. So we thought we'll give one additional special mention consolation prize. So a big round of applause and heartiest congratulations to the 3rd prize winner of the national poster competition organized by SVT College of Home Science in collaboration with World Food Program, Ms. Sejal Kamble. A glimpse of her poster is put together, and we were very intrigued by this entire roadmap of little cartoons put together, impact there. So I'm not sure if Sejal, you are here, but congratulations. Your prize and the details of your certificate would be shared with you shortly, and you would be able to get your certificate from us very soon. The second prize for this, again, it was very difficult for us to find from a huge list. And I'm very proud to say this is another SVT College of Home Science student, Miss Nicole Vegas. Congratulations, Nicole, for putting your ideas on paper in a very visually appealing manner here. So she talked about different aspects of how rice fortification is done, what are its nutritional impact, and what can be some innovative methods which can put together. So congratulations, Nicole. The first prize for this poster competition, Anuradha, do we need to get some drum roll here? But maybe not a drum roll. We can just wait for it. Yeah, so maybe just get rid of the suspense and let us have the round here. The first prize goes to Miss Ishwari Parshuram Jadhav from Dr. BMN College of Home Science. We really like the neatness and the clarity, not only on the paper, but also in your thoughts here, where you put together again the entire aspect of how we may fortify the future by fortifying rice as one of the initiatives here. So congratulations to each one of you for a much well-deserved prize here. We also have one consolation, I would not say, but a special mention, who is not in the top three, but who is very close to the top three. And that prize for the poster competition goes to Ms. Thoiba Iram Tanvi from Mount Carmel College in Bengaluru. So Thoiba, if you are here, a heartiest congratulations to you. Again, these girls are absolutely amazing when it comes to creativity, and it was a big struggle for us to find the top 4, top 5. But we loved your poster, Thoiba, and congratulations for that. Next, we move on to the essay competition here. Again, the essay competition's entire premise was to provide an academic platform so that we are able to capture diverse perspectives and somehow see what the students are thinking about the action-enabled roadmaps ahead here. And for this, we have 3 prizes. We can put all the 3 names together, Anuradha, if that's okay. Can you please? Okay, so third prize goes to Miss Divya Russell. Second prize to Bushra Hayat from Gokhale Memorial Girls College in Kolkata. And the first prize goes to Ms. Gladys Prince from Mount Carmel College, Bengaluru. So as you can see, we had amazing display from across the country, from Mumbai, from Bengaluru, from Calcutta. So I think the reach of this webinar was indeed across the country here. And again, big round of applause and heartiest congratulations to each one of you. We already had a question answer. Do we need more question answers or?
I think we will.
Actually, you can share the prize, the amount of prize which they are getting.
Yes, so
Share
for posts.
and my request is that all these posters and prize winners' essays should be put up on college website and should be linked with the WFP website, so that they get the visibility globally, not only in India but globally, that this is the kind of work which has been done by our students.
Absolutely.
And please do share us a soft copy of these posters as well. I think it's incredible work that these students have done. And if in some sort of a way or some small way, if we could acknowledge it, I think certainly we'll try and do that. So do share those soft copies with us as well.
Absolutely. We'll share the entire folder because, I mean, as I said, these were just few of the best ones. The others were equally good. Maybe marginally, some of us thought these were better than the rest, but we can share the entire list. And yes, the prize, I mean, more than the monetary prize, I think is the recognition that you would be getting on such a huge platform, which is very creditable for you. So for poster competition, the first prize winner gets an amount of 4,000 rupees and a certificate and a lot of appreciation across SVT College and WFP and a place on our website and perhaps on some communication channels of WFP as well there. The second prize is 3,000 rupees, second prize. Third prize is 1,500 and a consolation prize of 1,000 rupees for the poster competitions. For essay competition, the first prize winner gets an amount of 5,000 rupees. The second prize winner gets an amount of 3,000 rupees. And the third prize winner gets 1,500 rupees. So we will be in touch with each of the prize winners and we will be getting your bank details so that we can make the transfer, and also maybe 2-3 lines about how your experience was participating in this competitions, because it's always good to know what motivated you so that we can use that to motivate others in your group for these competitions in the future there.
One more suggestion, Panchali, tell them to send their little photograph.
Yes, absolutely.
Can also go along with their poster or essay.
So we will just make a small note and maybe share it with everybody, and then we will publicize it greatly. So congratulations once again, great job, and each one of you is actually a winner. Great.
Heartiest congratulations to all the students who have won their prizes and those who have participated. I wish to say here to all the panelists as well as the members that we have had essays and posters from Raipur and from in terms of Rajasthan and even from southern states as well and the eastern states. We have had a great representation from all over India for the various competitions, as Dr. Panchali has mentioned. And we move over to the vote of thanks, which will be proposed by Dr. Panchali.
Yes. I think let me begin by extending on behalf of the organizing team from SVT College of Home Science and the World Food Program, a huge sense of gratitude and heartfelt thanks and appreciation to the leaders, Dr. Jagmeet Madan from SVT College of Home Science and Dr. Sharika Yunus from the World Food Program, for conceiving this entire series of capacity building sessions there. And to Dr. Anuradha for not only taking their mandate ahead, but doing it such a successful job out of it here. So heartfelt vote of thanks to Dr. Jagmeet Madan, Dr. Sharika, Dr. Anuradha, and also to Ms. Nandita Joshi, if I can say, who has been the Fevicol between us, because somehow you have bound us together with three things together, whether it is the academia, whether it is the government, whether it is the development sector. You have always been trying to bridge the gap and bringing us together and delivering and actually leading all of these discussions that we had. Your questions in your panel discussion were also very poignant. The deliberations that you moderated were also very timely and relevant, and also the talk that you gave on different key policy initiatives by Government of India was also very interesting and insightful to look at. So thank you so much, Nandita, for being there with us and taking the mandate ahead along with us here. Sincere appreciation to Dr. Nisha Velare, who has always been there as a part of the coordinating team and been assisting and going ahead and taking part in every activity which has been put together. And also today she shared a very insightful overview on micronutrient deficiencies and malnutrition, which actually accentuated the need for rice fortification in the first place. So thank you so much, Dr. Nisha Velare.
Thank you so much, Panchali.
I am also thankful to Miss Samreen Khan. Her photograph is missing on the screen here because couldn't get in touch with her in time. But nevertheless, Samreen, thank you so much for designing the brochures and helping us with all the flyers and the email content and eventually for the social media and the reports as well. Thank you, Shifa Ansari, our young budding student of first year master's program, for managing the registration so well and always having the smile whenever we needed some minor changes, tweaks to be done, whether it was for the Zoom meeting links or for the number of registrations and sending them reminders, all of that. So thank you so much, Shifa. And again,
Most welcome, ma'am.
Once again, congratulations to all the prize winners who worked hard, whose work reflected creativity and critical thinking. And a huge round of thank you to also all the participants for being with us for last almost 3 hours from 6 till 9. For the students, we still have a class tomorrow. It's not a holiday, but thank you so much once again and making this webinar a huge success, and we look forward to many such webinars in the future, and we look forward to your active participation there. So thank you so much from my side.
Thank you.
So,
Thank you.
Thanks a lot.
Panchali, for your effort and yes, I think who other were the judges? Panchali, Apurva,
Miss Apurva, Dr. Nisha, and myself.
Dr.
Yes,
Nisha and Anuradha.
yes.
So thank you so much. This was a great effort. You know.
So we also have to thank Mr. Elton, who has been
Yes, you have
part of
to,
this
Elton, thank you very much. Big round
for
of
your
applause for
this
Elton.
live streaming.
I think I
And
miss Siddharth. I don't
yes,
know.
I thank you, Dr. Siddharth, and even
That's okay. I'm part of the team, so don't worry.
Oh, thank you so much, Siddharth.
No, no,
And
oh.
also, I think Mr. Patil, Sushant
Sushant
Patil ji,
yes,
Pramod
and
Patil
Pramod
ji.
Dr.
Patil.
Siddharth, yes, Dr. Siddharth has been such a huge support right from day one, and I think so encouraging. And the fact that Mr. Patil was here and the government representative, Nandita, we can thank them on our behalf.
Yes, absolutely,
Please.
I would. And Mr. Sushant Patil and Mr. Pramod
Mr.
Patil,
Pramod Patil.
both of them, the idea that they told me in the morning that it will be difficult for them to join because they have a meeting with FCI in Borivali and they would be on the way. But still, both of them joined. I am really, the government of Maharashtra is really taking a lot of efforts. I've seen them doing that. So yeah, I'll convey all the warm wishes to them tomorrow morning.
Yes, yes, please do that. Yeah.
Thank you so
So
much.
thank you. Yeah. Thanks a lot. This is the first series of
thank you to your
webinar.
kid also. Thank you to your kid for being so patient with you and
Yeah.
allowing us to continue.
So,
Thanks
thanks a lot
everyone.
for the first webinar. We have completed this, and this webinar will be followed by another series of webinars as we discussed in the introduction. And so we look forward for active participation from the academia as well as from World Food Program, Dr. Siddharth, Dr. Sharika, Ms. Nandita Joshi, as well as inputs from the government officials as well. And Dr. Jagmeet Madan ma'am for guiding us throughout this particular event, as well as for all the research work that is being done in this particular area. Thanks a lot, and thanks a lot to all the participants who have joined us.
Yeah, Anuradha, we can ask all the participants if some of them can switch on their videos.
Yeah, I think
we can
that's
just
a good
take
idea.
a quick group photograph in a grid view.
Yes.
We have all the names in between, but
yes.
I mean,
Yes,
some
we
of the
have the
students,
videos
why
on.
don't you please switch on? It's okay.
Those who can, huh?
Those who can, yeah.
Quick. I think they are all in their night suits.
That's okay. Come closer
Monday
to the
night
screen.
and,
It's okay. It's fine. We want your face. That's it.
No problem. I think they're just being shy. So
Okay, no
once
problem.
again, thank you so much. And good night.
Good night. Thanks a lot. Thank you.
Good night, everyone.
Good night. Thank you.
Thank you.
Thanks a lot.
Thank you.